Hey there, future pharmacists. Today I'm diving deep into pharmacokinetics, specifically drug absorption. Ready to unravel how drugs move from the site of administration into your bloodstream? Let's go. Absorption is crucial. It determines how quickly and how much of a drug reaches the bloodstream, impacting its therapeutic effect and potential side effects. First up, passive diffusion. Imagine a crowd moving from a packed room to a less crowded one. That's how drugs move from high to low concentration areas without energy. Take propranolol, a lipophilic beta blocker. Its high lipid solubility lets it zip through cell membranes quickly. Remember, passive diffusion is pH sensitive. Acidic drugs like NSAIDs absorb well in the stomach, while basic ones do better in the intestine. Next, active transport. This is like a VIP pass that uses energy to move drugs against the concentration gradient. Think of L-DOPA, which needs active transport to cross the blood-brain barrier using amino acid transporters. This is key for drugs targeting specific tissues like the brain. Then we have facilitated diffusion. No energy needed here. Drugs hitch a ride down their concentration gradient using a carrier protein. For instance, glucose analogs use this method, ensuring efficient absorption even in low-glucose tissues. Lastly, endocytosis. Picture cells as tiny Pac-Men gobbling up large drugs or particles, forming vesicles. Monoclonal antibodies often use this method. It's slower but essential for large molecules that can't cross cellular membranes otherwise. Now, factors influencing absorption. First, drug solubility. Lipid-soluble drugs pass through cell membranes faster. Take diazepam, for example. Its rapid absorption helps control anxiety or seizures effectively. Second, pH and pKa. The pKa of a drug affects its ionization at different pH levels. Furosemide, a weak acid, absorbs well in the stomach because it stays unionized there, promoting diffusion. Third, surface area. Bigger is better. The small intestine, with its large surface area, absorbs drugs more effectively than the stomach. Metformin absorbs here, compensating for its low lipid solubility. And finally, first-pass metabolism. This is when the liver metabolizes orally taken drugs before they hit systemic circulation. Lidocaine undergoes extensive first-pass metabolism, so it's given intravenously to bypass the liver. Now let's talk bioavailability. It measures the fraction of the administered dose that reaches systemic circulation in an active form. Here's the formula: F equals AUC oral divided by AUC4 times 100. For instance, if drug Y has an oral AUC of 45 and an IV AUC of 70, its bioavailability is 64.3%. That means 64.3% of drug Y reaches systemic circulation when taken orally. Mnemonics time. Remember, pass fast and enjoy for absorption mechanisms: passive, facilitated, active, endocytosis. And fat mug for absorption factors: first pass, acidic, transport, metabolism, uptake, gastrointestinal. Quick practice questions. 1. Why does propranolol absorb well through passive diffusion? 2. Calculate the bioavailability of a drug with an oral AUC of 60 and IV AUC of 100. 3. What impacts furosemide's stomach absorption? You got this. Keep exploring and stay curious. Until next time, keep those brains absorbing knowledge like a pro. Catch you later.